Assalamu alaikum everyone. I hope you all are doing well. In this video, we are going to discuss about the hepatitis and its types. Hepatitis itself is a general term that refers to the inflammation of the liver. There are two types of hepatitis. Number one, viral hepatitis, and number two is non-viral hepatitis. Viral hepatitis. The most common types of viral hepatitis are hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Let's discuss about the hepatitis A. It is caused by the hepatitis A virus, which is typically transmitted through the ingestion of fecal matter containing the virus. Hepatitis A symptoms typically appear a few weeks after you have had the virus, but not everyone with hepatitis A develops symptoms. If you do, symptoms can include number one, unusual tiredness and weakness, sudden nausea and vomiting and diarrhea, abdominal pain or discomfort, especially on the upper right side beneath your lower ribs, which is over your liver, clay or gray colored stool, loss of appetite, low grade fever, dark urine, joint pain, jaundice, and intense itching. Prevention. The best way to prevent hepatitis A is through vaccination. Additionally, practicing good hygiene such as washing hands thoroughly and avoiding the consumption of contaminated food or water can help reduce the risk of hepatitis A transmission. Hepatitis B. Hepatitis B is caused by the hepatitis B virus, which is primarily transmitted through contact with the infected blood, semen, or other bodily fluids. Additionally, an infected mother can pass the virus to her baby during the childbirth. Hepatitis B virus can cause both acute and chronic infections, and chronic hepatitis B virus infection can lead to liver cirrhosis or liver cancer. Its symptoms include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea or vomiting, weakness and fatigue, jaundice. It is prevented through vaccination, and it can also be prevented by avoiding high risk behaviors such as engaging in unprotected sex or sharing needles. Hepatitis C. It is caused by the hepatitis C virus. You can catch hepatitis C if the blood of someone who has hepatitis C virus enters your body. The following symptoms may occur with hepatitis C virus infection: pain in the upper right abdomen, abdominal swelling due to fluid, clay colored or pale stools, dark urine, fatigue, fever, itching, jaundice, loss of appetite, nausea, and vomiting. Steps that can be taken to help prevent the spread of hepatitis C virus from one person to another include: healthcare workers should follow precautions when handling blood, do not share needles with anyone, and do not share personal items such as razors and toothbrushes. Hepatitis D. Hepatitis D, which people sometimes call delta hepatitis, is a viral infection that occurs due to the hepatitis D virus and causes inflammation of the liver. People get hepatitis D through the contact with the virus in the bodily fluids of the infected people. However, a people can only get hepatitis D if they already have hepatitis B, because hepatitis D virus uses the hepatitis B virus to replicate. People who are more at risk of getting hepatitis D include those who have hepatitis B, have not received the hepatitis B vaccine, inject drugs, have unprotected sex with multiple partners, and lives in a part of the world where hepatitis D is more prevalent. People with acute hepatitis D may have the following symptoms: fatigue, loss of appetite, pain in the upper right abdomen over the liver, dark urine, lighter stools, nausea, vomiting, and jaundice. Hepatitis E. It is caused by the hepatitis E virus. Like hepatitis A, it is primarily transmitted through the consumption of contaminated water or food, particularly in areas with inadequate sanitation and poor hygiene practices. Some of the common symptoms of hepatitis E virus include mild fever, feeling tired all the time, poor appetite, nausea and vomiting, abdominal pain, itching, skin rashes, jaundice, joint pain, and enlarged liver. Prevention of hepatitis E primarily involves ensuring access to safe drinking water and practicing good hygiene and sanitation measures. In areas with a high prevalence of hepatitis E, it is advisable to drink boiled or treated water, avoid consuming raw or undercooked meat, and practice thorough hand washing before handling food. Non-viral hepatitis. Non-viral hepatitis refers to forms of hepatitis that are not caused by the viral infections. These can be categorized into the various causes including autoimmune hepatitis. It is a condition in which the body's immune system mistakenly attacks the liver cells, leading to liver inflammation and damage. Alcoholic hepatitis. Alcoholic hepatitis is liver inflammation caused by excessive and prolonged alcohol consumption. Alcohol damages liver cells, leading to the inflammation and, in severe cases, scarring of the liver that is called liver cirrhosis. Drug-induced hepatitis. Certain medications, toxins, and herbal remedies can cause liver inflammation and damage. Drug-induced hepatitis can occur as an adverse reaction to the medications or as a result of overdosing on certain medications. Metabolic disorders. Certain metabolic disorders can lead to hepatic inflammation and liver damage. Examples include Wilson's disease, which is characterized by the abnormal copper metabolism, and alpha-1 antitrypsin deficiency, where there is a deficiency of a protein that helps protect the liver. Ischemic hepatitis. Ischemic hepatitis, also known as shock liver, occurs due to the inadequate blood supply to the liver, typically caused by the severe low blood pressure or reduced blood flow. It can be a complication of conditions such as heart failure, severe infections, or extensive surgery. So this is it for the today's video. I hope you guys liked the video. Thank you for watching. I will catch you guys in the next video. Till then, Allah Hafiz.